Tassone. I am here in beautiful York, Maine, and it's been a couple of days just because I've been traveling. So I wanted to kind of come on and talk about um, probably the hormone that I get the most fear and questions about, and that would be estrogen. And I wanted to talk about estrogen because even though we talk about it and we know that estrogen is good for you and it's safe, there's still a lot of people out there that think that it's risky. And they're worried about cancer. That's the main risk that we talk about with estrogen. But you want to remember, oh God, you shouldn't be on estrogen, it causes cancer. What they're probably referring to is the Women's Health Initiative. And when that came out about 15 years ago, it basically said what we already knew was in the package insert for the medication was that it had an increased risk of breast cancer, but that was the combination pill Prempro, and that is a synthetic estradiol that was made from horse urine and medroxyprogesterone. There was no real effort done on bioidentical hormones, and it's because bioidentical hormones don't have the money to back them like big pharmacies, so you probably won't ever see that. But the study that I talked about that came out about a month and a half ago was done on estradiol and progesterone and actually found that women that are over the age of 65 who have a problem with menopause, hot flashes, mood swings, irritability, osteoporosis, heart disease, that these women had that were over the age of 65 that were on estradiol had a decreased risk of breast, colon, and lung cancers. There was decreased dementia, and there was a overall 19% reduction in mortality in those women. Now, this was 10,000 women, so this wasn't a small study. So the thing about it that you have to understand is that estrogen in and of itself is not a risky hormone. Obviously, it can help with bone disease. It can help with um, heart disease. It raises your good cholesterol, lowers your bad cholesterol. I know I'm coming on live kind of at a weird time also because here it's 5 o'clock, but in my usual stomping grounds of Austin, it's only 3. So I know it's a little bit early, and I'll take that into consideration next time. Keep in mind that with my lives, you can always ask me questions if you have any. I think I can see them on here somewhere. If not, I'll get to them later. But I just wanted to reiterate, estrogen is not something to be afraid of. Estrogen is something to be heralded as probably the best medication for women's health and for your health. And I just wish we could get over the fear that we have of estrogen because it's not something to be feared. It's actually something to be happy about and something that can help you live a happy, healthy, productive life, help you stop losing bone, help you with your heart, gets rid of hot flashes, helps with vaginal dryness, sexual activity. And we all know that a good sex life means you live longer, so you can't go wrong there. And I just wanted to talk about um, that because I'm just thinking that there's so many women out there that are being told such misinformation about hormones currently. And the other thing on the flip side, then you're being told by all these coaches and whatnot that you should try this supplement, you should try that supplement. The reality is there just aren't a ton of supplements that you have to use, if any. Number one supplement that I would say helps with menopause is vitamin D. And the reason for that is it's responsible for so many things in the body. And actually, vitamin D in and of itself is a hormone. So, vitamin D, I wouldn't take more than 50,000 units a week. And I probably would opt for about 5,000 units a day, would be what I would go for. Otherwise, you're probably taking too much. The next one would be magnesium. I think magnesium's great for sleep. It's great for a lot of functions in the body. It's good for stress. I think that maca, which is feminescent, is also one of my favorite things to use. So there's a lot of things out there you can try. Any of these companies out there that have these formulas like Happy Mammoth and blah, 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 alloy, all these things, completely unnecessary. These kitchen sink supplements that have like a million things in them. You don't need them. You just simply don't need them. And so it's a scam. Most of these companies now are hiring the most recent one, Elle McPherson. She's just gotten into menopause and figured out that she's got menopausal issues. So she magically founded this company that has these supplements that apparently are going to save your life. Although I'm not sure what we did before we had Elle McPherson, but she should probably just stick to modeling. But she's going to make a lot of money. And that's the thing. Menopause is a huge money-making industry. And I'm not saying that that's good or bad, but keep that in mind because there are a lot of people out there peddling stuff. Hey, Dr. Tassone and everyone. Hey, Liz, how are you? Liz is the newly created cougar by her own admission. I think that's hilarious. I've never had anybody tell me that before. I think that's awesome. My LH is 77, FSH is 66, estrogen is 15. Is that high for somebody just told you entered menopause? Yeah, that sounds like menopause to me. Obviously, I can't talk about your specific care, but LH and FSH are over 40 and your estrogen is almost zero. At your age, that's probably menopause. I mean, that would be my guess. So is vaginal use of estradiol what you're referring to? No, I'm talking about topical estradiol, meaning you don't need vaginal estrogen if you're using regular systemic estrogen. You don't need a vaginal estrogen cream in 99% of cases if your circulating estrogen levels are fine. When I talk about topical estradiol, I'm talking about the kind on your skin. It could be vaginal, but there's no point in using vaginal estrogen if you have vaginal dryness if you have good allowed estrogen. So what happens is doctors prescribe vaginal estrogen because they don't want to prescribe regular estrogen. It's the same stuff. And actually levels go just about as high. So the doctors that are prescribing it don't really know much about estrogen. And what it shows you is that they're still afraid of estrogen because they think they should just give it to you vaginally instead of giving it to you systemically, which is just silly. Yeah, she should stick to modeling. You're getting my book. Oh, thank you so much. I had a lady give me a hard time the other day on here because she was saying that I'm always promoting my book, and it's kind of funny because if you have a book, why wouldn't you promote it? She actually called my office and told my office staff that I just should stop talking about my book. So I'm not going to because I do the exact opposite of what I'm told. And any of you that know me know that's why I'm not in the big group that I used to be in because I used to say things to them that they didn't like. And this old group that I was in, there was 10 docs and they used to think that what I did was witchcraft. Now, magically, they're all into hormone replacement. And guess what? They're putting in pellets. So imagine that because it's a moneymaker and that's all they cared about. Do all of these hormonal changes in menopause and perimenopause cause women to be more insecure? Never in my life have I felt insecure. Well, I wouldn't say that that's necessarily the cause. What I usually say is hormone issues amplify what you're feeling. So anxiety, depression. If you also have low hormones and you just don't feel good, I think that's like putting things under a magnifying glass. So if you were already feeling, kind of not quite like yourself, maybe, the weight gain, maybe just not feeling good, maybe that's added to the insecurity and that's why it's being amplified right now. I think it's just kind of it's like the straw that broke the camel's back kind of a thing. So glad I go over the fear and started HRT. Me too. Good for you. Great for you. I think HRT is probably the best decision a woman can make in her life. I think it gives her a healthy, happy life to live, and I think it makes her feel a heck of a lot better. Sorry, I'm gonna rest my arm because I'm tired of the bouncing. So, that being said, I do think the first place and best place to start is by getting a copy of my book, The Hormone Balance Bible. Sorry, I just have to say it. And please let me know in the comments if there's any topics that you just feel you would like a little more information on. Is estradiol 15 for postmenopausal too low? Well, 15 just means you're postmenopausal, and that's normal for menopause. It's not going to protect your bones. It's not going to give you any results. You probably still have hot flashes. I just had blood work. Estradiol is 67, progesterone's 4, testosterone 0.4 and 6. I can't give you a medical advice. You can call my office at 512-956-0296, and I'll be more more than happy to help you out. Look at your plan, look at your levels, look at what medications you're on, and consider changing things up a bit. I started a HRT patch, gained 11 pounds. Unless it's been 6 months, it's not hormones directly. You can gain weight on HRT because if you haven't been on it for a while, you're going to lose a lot of water density because estrogen helps you retain fluid. So probably at least 5 or 6 pounds of that is just fluid retention. That's supposed to be there. Also, you know, weight gain is tough. It's multifaceted. There's insulin, there's glucose, there's exercise, nutrition, hormones. It's one piece, but there's a lot of pieces there. Would love more info on thyroid. My GP just told me I have Hashimoto's. Hashimoto's is a great topic. I'll remember that. Hashimoto's is an autoimmune disease where your body mistakenly thinks that your thyroid is a foreign body and attacks it. That may eventually make you hyperthyroid, but then could make you go hypothyroid. So I work on the inflammation part. I use low-dose naltrexone, I use Zyflamend, I use hormones, so we can work on that. GYN rolled her eyes when I told her about you. She said I was too old for treatment at 63 and postmenopause. Anybody that rolls her eyes, I mean, to me, that's just rude. I don't think anything that I'm saying is crazy. It's not like I'm telling you to rub horse dung on yourself. I might roll my eyes about that. But if she rolls her eyes, that just means she's a negative human being and probably shouldn't be seeing patients anyways. Told entered postmenopause, but they said my levels were fine. Well, they could be fine, but zero, I mean, that doesn't, I mean, zero's normal, but it might not feel fine. That I don't need hormone therapy. I mean, if you've entered menopause and your levels are fine, first of all, that doesn't make sense. Because if you are in menopause, then your levels should be zero, not fine. And if they're telling you how you feel, if they tell you that you feel fine, blah, 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 find someone else because that's called gaslighting. Will chamomile flush out my new HRT? No. I mean, even if it did, you'd probably have to eat pounds of it. Chamomile, I've never heard of that doing anything to your hormonal therapy. So, like to keep these around 10 minutes. We're already pushing 13, and we usually pick up steam as we go. There's 28 people here. Like I said, put some topics in here that you want me to talk about. Share these videos because I would love to be able to reach 1 million women, and I'd like to get more subscribers just because I think the more questions that people ask, the more people that find me, that more doctors that roll their eyes at me, that just means that the message is getting out there and that women are starting to ask questions. I love the fact that you're asking questions. So if I call your office and we talk, can you order? Well, what happens is when you call the office, we order all the tests at that time. Then you call me when you get the test done, and then we go over the results. Hi, doctor. I was wondering, I'm still getting periods, but I started progesterone every other day. First of all, progesterone every other day makes absolutely no sense. I don't know why they're doing that. That's a weird thing I've never heard of. Doesn't tell me that the doctor you're seeing knows much about what they're doing. They're totally making that up. So you might want to find somebody else, first of all. You got the book. Oh, thank you. That's very kind of you. Appreciate it. The Hormone Balance Bible on Amazon. For the lady that didn't like the fact that I always talk about it, I'm sorry, but I'm getting asked questions, so I got to answer them. I've been telling all my friends about you and your book. Thank you so much. Share if you can. Share this video. Share with your friends. Share with other women. Actually, I'm surprised the number of women over 60 that are on YouTube blows my mind. It's crazy. And I'm so excited because it's a new demographic for me that is great. Does cycling progesterone make sense? In a menopausal woman, absolutely not. Cycling progesterone in menopause is something that's been totally made up by a well-known OBGYN. She's completely made this up. It's her belief structure. If you listen to her talk about it, she uses a lot of mumbo-jumbo psychobabble that makes absolutely no sense. There's no research to back it up. It makes absolutely no sense for a woman over the age of 50 to cycle and have a period. There's no benefit to it. And if you really believed in the benefits of progesterone, then why wouldn't you want that every day? Yeah, get another doctor, Diana. I'm 12 years out from menopause, was told you missed your window. I've helped women older than you. You didn't miss your window. It's a discussion you have. You go over the risks and the benefits. In most cases, the benefits outweigh the risks. I wouldn't say you're too old. I would consider getting a calcium arterial, a CT of your arterial calcium in your heart, coronary artery scan. It's probably $95 to $150. It's a 5-minute test where they look for heart disease. I think if you can get that first, that would be helpful. Book is on sale on Amazon. You're right. It's like 45% off. I would like you to do a discussion on getting polyps and frequently. How many times should someone get a scope at a DNC? I can talk about that. I do have an episode on Confessions of a Male Gynecologist where I talk about hysterectomies. I think if you're having a DNC and you're doing probably more than 1 or 2 a year, that's a lot. But again, I don't know your medical history. Be more than happy to talk to you about that in person with a visit. So I'm going to end here if I can figure out how to turn this off, and because I'm on my phone this time. And please drop some messages. I will be back tomorrow, and we'll talk then.